Hi, my name is Vonda Vaden Bates, and in 2012 I started paying a lot of attention to healthcare for the first time in my life. That's because in 2012, my beloved husband, Yogi Raj Charles Bates, died from a hospital-associated venous thromboembolism. That is a blood clot that can travel to the lungs and is often fatal, as it was for my husband. What I learned thereafter was that my husband and I had gone into the hospital thinking and assuming that that might be one of the safest places that we could be during a time of crisis for him. And unfortunately, what we later learned was that across the world, hospital systems, healthcare systems, medical care in general is not as safe as we presume it to be. And it is not really very helpful, in my opinion, to try to figure out who's to blame for that, which is in large part the way that that situation gets handled right now. What I think would be way more important and helpful, and what my colleagues who I have met over the last 8 years, who have spent their careers looking into this study, studying this, looking into this dynamic, we know a few things work really well. And I would have very much liked for the hospital where my husband was, where the hospital where you work, where the hospital that you are the administrator or a board member for, or the hospital where you might go someday. I want every hospital around the world to be able to prioritize safety, prioritize it in a way that absolutely brings every person who's involved into the equation as a person first, not as a patient, not as a clinician, not as a this or that, not a title. We are not our titles. We are not our diseases. We are people trying to do the best thing that we can do when something is interrupting our health and well-being, and or that of the health or well-being of another person. And so what my colleagues have proposed, and what I've done quite a bit of research on, although I certainly don't claim to be a clinician, is that it takes a little bit more time for us to get to know each other. So the next time you have an appointment, maybe consider offering a pamphlet to your patient that doesn't say hospitals are terrible places to be, but does acknowledge that complications can arise. And we're doing our very best to stay on top of how to make sure that we keep you safe and us. And we really want you to be partners with us in doing that. That goes a long, long way in trust building. And also, if you're a patient and you're going in to see your nurse, your doctor, don't hesitate to ask them what they do to make sure that that environment is safe. It's a fair question, and a good reception to that question will probably very likely line up with a good partnership, and that partnership can make all the difference in making sure that you have the best delivery of care possible, receive the best delivery of care possible. Lastly, I want to talk just a little bit about patient and family engagement, which is another term that you might hear used if you begin to take a look at this issue a little closer. Or if you already are, you probably helped create this term. Person and family engagement is really looking at bringing the patient and the family member or the loved one to the table on the planning of care, way ahead of the illness, way ahead of anybody walking through the door. What is the environment like? What is the culture like? What decisions do we make when we need to prioritize budget and safety? Bringing patients and family members to the table, especially people who have experienced some errors, whether or not those caused harm or not, can really go a long way in helping make sure that you're creating a culture of safety in your area. And those are the kinds of acts that if you're a patient, I would look for that. Ask about that. They might have a patient safety officer on staff. It's okay to talk to that person. Take a look at Leapfrog. Leapfrog does a grading system on hospitals. If your hospital's not reporting in there, ask them why or why not. There are very simple things that you can do to make sure that when you go to get care, it's safe for you. There are also things that people who deliver care can do to make care safer. And one of those things that I know my husband would say if he were here today, I'll say it for him, but I also say it for myself, is that take the time that you need to be healthy yourself. If you're devising policies for other people and you're burning candles at both ends and sleep deprived or haven't taken a rest recently, overworked, overwhelmed, any of those things, you might not necessarily be making the best decisions on behalf of another person. You may want to, but you may not necessarily have the wherewithal to do that effectively. It doesn't make sense to exhaust healthcare workers. It doesn't make sense to not have sufficient healthcare workers when we have surges like what we've seen over the last few months, several months. So I really want to propose to administrators, but also to clinicians and family members and patients to speak up. The reason I'm zigzagging from Southern California to Capitol Hill, even though I'm probably just going to have to meet with my congresspeople virtually anyway, is because I really believe that if we started talking about this in earnest, openly and honestly, rather than sweeping things under the rug or ignoring it because we just don't have time to talk about that, we're just too busy trying to heal or help our loved ones heal, we can start talking about it proactively, and that's going to make a big difference. So that's why I'm here. That's what I'm hoping you will do. That is why I'm asking you to unite for safe care.